Well, first of all, the pelvic floor training program was designed with the input of world-class physiotherapists to make sure it was the best possible program. And so what we did was to create a video every week, about a 10-minute video every week for the 26 weeks. And then in the program, the daily email asked the guys to follow that week's video. It's 10 minutes 3 times a day. And they also had potential reminders, text reminders. And in the video, we actually taught them a relaxation technique, because practicing relaxation is actually better for the pelvic floor physiology. And then there were both long holds, which targets the endurance muscles, and the quick twitches, which targets the quick fibers. And then we also had them do an anti-incontinence technique. So it's a program, and it's progressive because each week it got a little bit more complicated. And so we were asking these men to do this program. And in the randomized trial, they did this pre-operatively prior to their surgery for probably about 2 to 3 months on average prior to their prostate. And so therefore they had about 3 to 4 months post-operatively. And essentially what the study showed was that at the 3 to 4 month point post-operatively, the guys had better symptoms of all urinary symptoms. So their bother, their urinary leakage, the other aspects of the urinary symptoms were actually improved through the entire group. So both the radiation and the surgery patients had improved urinary symptoms. However, it was even more beneficial or more obvious, both statistically and clinically, in the men who underwent a radical prostatectomy. So what was also unique about the study is that we reminded them through text reminder to do their pelvic floor training 3 times a day. And we also captured weekly how compliant they were with actually following the program. And what we found is overall during the 6 months, the men were 76% compliant with the actual prescribed program.